Support comes from Mosby Building Arts, replacing old windows for smoother operation and home comfort. More at callmosby.com.
From the St. Louis Public Radio Newsroom, this is The Gateway. It's Monday, April 21st. I'm Jonathan Ahl, in for Abby Larico. Increased tariffs on many countries have been a hallmark of the first months of the second Trump administration. And a researcher in St. Louis finds these new levies will likely have broad and varied effects on the global supply chain.
The increase of costs at early stage of a supply chain will ultimately be cumulated to the consumers.
STLPR's Eric Schmid sits down with this researcher to learn how tariffs may affect the supply chain of different goods and what that means for the country. That's coming up on The Gateway. The Missouri Department of Health and Senior Services on Friday confirmed the first case of measles in the state this year. St. Louis Public Radio's Sarah Fenton reports health workers diagnosed the infected patient in Missouri soon after the child's arrival in Taney County in southern Missouri.
Officials say the case is associated with recent international travel, and there isn't evidence of widespread exposure. Health workers have reached out to people who have been in contact with the infected patient. The Centers for Disease Control and Prevention this year has reported 800 measles cases in 25 states. DHSS Chief Medical Officer Heidi Miller says vaccination's the best way to prevent serious illness.
The repercussions of a vaccine-preventable disease like measles it can be death, it can be permanent cognitive impairment, it can be chronic disease.
State health officials do not yet know if the child was vaccinated. The CDC reports most measles cases this year have been in people who are unvaccinated or whose immunization status is unknown. I'm Sarah Fenton, St. Louis Public Radio.
A St. Louis alderman says it may have been a blessing in disguise to not spend all of the St. Louis Rams settlement funds. Before St. Louis Mayor Kara Spencer took office, the Board of Aldermen couldn't agree on how to spend roughly $300 million in Rams money. Some aldermen wanted it to go towards water infrastructure repair, downtown projects, and distressed North St. Louis neighborhoods. But Alderman Rasheen Aldridge says it will be good to have the money in the bank. He added, though, debate over how to spend the money isn't over.
We're not sure what is going to come out of the federal government, and I think, ensuring that we have money to be safe with, to play with in the city, I think is beneficial, but I'm sure absolutely another Rams bill will be coming down this session.
Aldridge was a guest on the Politically Speaking Hour on St. Louis on the Air. Missouri's new Children's Division director is taking a closer look at child fatalities that occurred before she took the job last month. As St. Louis Public Radio's Jason Rosenbaum reports, that pledge comes after documents show that Children's Division officials showed up multiple times to a home where a child eventually died.
Last year, Hayden Rosner and Riley Ferraro were charged with a number of offenses after Ferraro's 4-year-old son died. Documents from an open records request show that Children's Division officials visited either Ferraro or Rosner in Fredericktown 4 times before the boy died. Children's Division Director Sarah Smith says her agency is looking into whether there was any attempt to remove the boy before his death.
If there's an opportunity for us to learn for something, especially a tragedy such as these fatalities, we should be transparent.
Smith became director of Children's Division last month. I'm Jason Rosenbaum, St. Louis Public Radio.
The Creve Coeur-based health system Mercy has introduced a health care program for pregnant and postpartum women with mental health and addiction disorders. The program provides medical and mental health care and social support through telehealth and at the Mercy campus on Ballas Road in St. Louis County. The BRAVE program is designed for those who are pregnant or up to 1 year postpartum and addresses addiction to alcohol, tobacco, cocaine, and other drugs. Drug and alcohol use during pregnancy can cause birth defects, mental health issues, and other problems for developing fetuses. Substance use disorders and mental health problems, including suicide and overdoses, are one of the leading causes of death in Missouri women who are pregnant or who have recently given birth. The health system held a grand opening at its campus on Friday, but the clinic has been open since last month. There's now a new historical marker at the former Philippine Village exhibit site in Clayton. The exhibit is remembered for its violent history of displaying Filipino and indigenous people at the 1904 World's Fair. Hiba Ahmed reports.
Local artist and researcher Jana Año Nuevo Langholz has carried around a makeshift sign around the Philippine Village historical site for years. She no longer has to do so. She joined Clayton Mayor Michelle Harris and the Clayton Community Foundation in honoring the lives of hundreds of Filipino and indigenous people who were violently displaced during the 1904 World's Fair.
Falayay, Basilio, Mora.
In what were known as human zoos at the time, the people were brutalized by visitors. The marker now stands at the intersection of Damon and Northwood Avenues in the Wyandotte-Skinker neighborhood. I'm Heba Ahmed, St. Louis Public Radio.
The Trump administration's back and forth on tariffs has dominated the headlines recently. A St. Louis researcher says there's not enough attention on how this economic tool will affect supply chain. Haitao Lee is chair of the Supply Chain Analytics Department at the University of Missouri St. Louis. St. Louis Public Radio's Eric Schmidt sat down with him right after the Trump administration paused so-called reciprocal tariffs earlier this month.
I don't think it's a good idea to have a generic list, any type of list, okay? Whether the list is a list of countries, a list of products, or a list of industry. Simply trying to impose tariff in a reciprocal way, I don't feel that pay enough attention about the need of a global supply chain. Global sourcing still has its value, making the supply chain operation efficient. Depending on where the tariffs are imposed, it does have very different immediate impact, right?
What do you mean by that?
If tariffs is imposed on the finished goods of an end-to-end supply chain, presumably immediate impact would be the market price and, perhaps bared by consumers. But comparing to that, the input sector, when tariffs are added on raw materials or parts, it is the manufacturer or processor who gonna immediately bear that increased cost.
How does the increasing in cost along that early supply chain affect, consumers later on?
When you think about the supply chain system or structure, cost, at the same time, value are added step by step, okay, in a cumulative way. That simply means the increase of cost at early stage of a supply chain will ultimately be cumulated to the consumers.
Which products or services in particular are you paying most attention to as it relates to the tariffs that are being implemented or not?
I'm very concerned about food because this is a sector that touches normal people's life, mid-class and people who are in need. We're still having this huge challenge of food insecurity, even in the US. We have many people who do not still have easy, quick access to not just availability of food. We're talking about nutritious food. I'm also very concerned about the pharmaceutical industry, especially API products, the active pharmaceutical ingredients, which will potentially impact the national public health of this country. Another one I can think of is the critical mineral industry because this is a type of raw materials that we use a lot to manufacture the EVs, the battery especially, which is projected to grow. Currently, U.S. only have a very small portion of those critical mineral supply chain.
What are some of the ways that tariffs can be effective when applying them from a supply chain perspective? How do they work best when considering the supply chain?
Using a little bit terminology in manufacturing, a supply chain can be described by the so-called bill of materials. That include all the required inputs, raw materials, parts, semi-finished goods, including their dependency. When you see that structure representing a supply chain, we will be able to precisely capture the cost added at every stage cumulatively through the supply chain. And there is also analytical approach now available, models and methods to optimize that. Given a certain amount of tariff we want to impose, let's say for this entire supply chain, right? So one of my questions would be, what is the optimal way to distribute that tariff along the supply chain, right? Differentiating between finished goods versus working process products, parts, or raw materials.
That was Haitao Lee, chair of UMSL's Supply Chain Analytics Department, speaking with STLPR's Eric Schmidt. Find more of their conversation on our website, stlpr.org. Brian Moline edited that story. The Gateway is a production of St. Louis Public Radio, music by Ryan McNeely of Adult Fur. We are a member-supported service of the University of Missouri, St. Louis. I'm Jonathan Ahl, and from the St. Louis Public Radio newsroom, this has been The Gateway.